So what Emily just popped into the chat is a link to the CDC's website where they have all kinds of useful resources for folks who are planning or executing or writing up their community health needs assessment or any other kind of related project. And I can't remember who right now brought up the fact that they were looking forward to running a community needs assessment sometime very soon here and are looking at doing it jointly with other groups. But I thought it would be useful for folks to have a look at the resources there on the CDC's website and also potentially circle back to that later this morning if there are other questions related to how to run a community health assessment or a needs assessment. So this morning, we're going to spend our first hour talking about SWOT analysis. And I'm interested in hearing from people in our second poll about the extent to which you've already relied upon developing a theory of change or using a logic model approach. And if you could just hold off on that poll for one sec there, Desiree, I'm going to pop that into my remarks a little bit later. But first, I want to start off by talking about SWOT analyses and what that refers to. Okay, so SWOT is an acronym that stands for strengths, weaknesses, opportunities, and threats. And so it's typical in the sort of nomenclature and language around program planning and evaluation to see this approach being used. And so when I'm reading a grant proposal or a final report or any other kind of evaluation report, be it a formative one that's written at the beginning or midpoint in an evaluation cycle or a summative report at the end, I like to see people using this kind of terminology and nomenclature because it is a good way of framing up the challenges and the approach to them. And it's also just very typical in the field of planning and evaluation to see people using this approach. And so if you're using it as well, it kind of signals to your reader that you're familiar with the fact that this is the conventional framework to use. So when we are thinking about strengths, what are those positive internal attributes of the program team in this instance? What are the negative internal attributes of the program team comes under weaknesses. Opportunities are the external threats, external factors that could improve the program team's prospects. And then the threats would be external factors that can undermine the program team's prospects. And so thinking through some of the features of the log frame approach that we covered yesterday, including, for instance, stakeholders, and conducting a stakeholder analysis is really a foundational step where you can use the SWOT analysis to frame up you and your team's thinking about the relative importance, I suppose you could say, of different kinds of stakeholders. So are different kinds of stakeholders in your community going to pose or contribute a strength? Are they going to, for instance, be a type of a weakness? Or do they represent an opportunity, or could they be threats? And so using the example that I was relying upon yesterday in terms of thinking about opinion leaders in the community, such as perhaps faith leaders, maybe you don't conventionally think of faith leaders, people that you're involving in public health programming, but they, in many instances, can be very important swayers of public opinion toward a project. And so depending upon the relationship that you have cultivated or forged with individuals like that in the community, they can sometimes represent a very substantial opportunity to enhance the strength of the program and its likelihood of success, or in some instances could represent a threat for whatever reason. And so working together with them to understand the perspective that they bring to the table and why they might ascribe to a belief system, for instance, that is challenging to the one that your program is based upon is a very important step moving forward. And I think in public health programming and public health program execution, oftentimes the consideration of these factors is thought to be like maybe something that you would worry about in very small traditional communities in other parts of the world. But in fact, what we have seen time and again in the literature is that even in America, even in contemporary modern America, particularly in rural communities, but not just in rural communities, having these kinds of opinion leaders and community members on the side can be a deal breaker or can make a program succeed. And so anyway, using a SWOT analysis, strengths, weaknesses, opportunities, threats analysis to think about your stakeholders can be very, very useful. Okay. So the purpose of the SWOT analysis is to assess the performance and capacity of all the participating units or divisions of your organization. And I know from what we discussed yesterday that in most instances, in the folks participating in our training yesterday and today, you don't have a big organization. So take this with a grain of salt. I think most of you are working with teams of 3 or fewer, in some instances 5 people or fewer. But still, this first step in the SWOT analysis in terms of assessing performance capacity of each team member is important. So each participating unit should undertake a SWOT analysis. And this is really a very useful tool for appraisal of your office or institution. And it can be a very useful brainstorming activity as well. You know, a lot of the program planning that we do, the most important steps are at the generative phase where we're sitting around the table with our team members or taking time ourselves alone in some circumstances to just think through all of the contingencies that are potentially down the track as you try and execute a public health program. And so in that way, you know, I've relied pretty heavily in my remarks yesterday and a little bit so far today on thinking about the brainstorming exercises that we're engaged in as program planners or evaluators. And it is really important. It is a common pitfall in program planning to forge ahead too quickly and to jump into execution phase before taking the time to do the brainstorming exercises needed to foresee some of the threats and build upon some of the opportunities, for instance, with the SWOT approach. So if we were to think about using the tobacco cessation example that I've been relying upon in our training, if we were to think about a tobacco cessation SWOT analysis of the different kinds of stakeholders and possible participants, we might develop a chart that looks something like this, where at the top I've listed the strengths in terms of potential participants, maybe DPHHS, our local and county health officers or other practitioners or professionals, tribal health, maybe some local private labs or facilities like Rocky Mountain Biological Lab, depending upon the kind of work that we're doing. Maybe the Montana University system, like I mentioned before, relying on the very substantial brain power or available research expertise of the faculty across the Montana University system. Also public interest and public cooperation. Those are all types of strengths that you might consider. In terms of weaknesses, coordination and messaging and just basic communications with the messaging between your office and these units can be quite a bit more time intensive than people might think from the outset, and might include a little more care and massaging of messages and communications to make sure that everybody feels appropriately included and equally important and so forth in their the strength of their voice at the table and planning and helping execute a program. Opportunities, like you can see here on the chart, linking together some of those strengths listed above, maybe talking with, say, a private, like a local lab or other kind of clinical facility about potential business growth associated with participating with the project. And then thinking about working with those entities to look ahead to prevent future disruption, which is good for everyone. And then in terms of threats for those participators or players linked that are listed at the top, we have things like economic threats, downturn in the economy or supply chain disruption, and then obviously misinformation from media sources or other sources can play a significant role. And I think we're all very familiar with that based on our experiences going through the pandemic and the non-trivial amount of confusion that the public experienced as a result of so many different messages that we were all receiving about about COVID-19, for instance, and the efficacy of vaccines and so forth. And so we're all very familiar with the significance of that particular kind of threat. Okay, but using this SWOT analysis approach can really help you and your team members start to forecast some of these things and build on the opportunities and strengths and mitigate the weaknesses and the threats. It leads us right into step 7 of the program, the log frame approach to program planning and also evaluation. And so for folks who are just joining us today, yesterday, and by the way, we've got all the slides handy and ready to disseminate to folks. We did part 1 yesterday. We'll do parts 1 and 2 disseminated after our training today. So for folks who are just joining today and weren't familiar with or aren't familiar with what I covered yesterday, I went through a couple of different approaches to program planning and evaluation, including RAND and pre-seed and co-seed, but I landed squarely on and have focused this training on the logical framework approach, which is the most commonly used one. And it has 10 steps and we're on step 7 now. The notes that I provide in the slide are very detailed, and you can refresh your memory afterwards or maybe go back to them in terms of maybe, for instance, building out some of the tables or objective trees or problem trees or what have you. That might be useful in your own program planning and evaluation exercises down the track. So step 7 of that process is the step where we construct our theory of change, and sometimes people refer to that as our logic model. What is the logic behind our thinking? Remembering, of course, that log frame is it's an if-then based set of logically connected statements. And so I suppose we know from its name, logical framework, the significance of logic is very strong, and it's the through thread through all 10 of these steps. So this is really the centerpiece of the log frame approach, I would say. What we've been talking about so far are the fundamental, like foundational building blocks in steps 1 through 6. And then step 7 is the centerpiece. And then steps 8, 9, 10 follow as the execution and analysis and dissemination stages. So the theory of change and logic model are used interchangeably, and they lead right into the construction of the problem tree. So one time I was working with a group of Ugandan people who I think felt like folks who do trainings are a little heavy on the theory sometimes. And one of my colleagues asked me, I started to introduce theory of change, and he was like, oh gosh, not another theory. And I was happy to reassure him and you that I'm not going to teach you about a theory next. Theory of change is your theory. What is your thinking and your logic about why the program that you are planning and its component pieces, why they're going to have the effect that you are predicting they're going to have on a particular health behavior or health outcome. Okay, so the purpose of the construction of a theory of change or logic model is to identify the main challenges and their primary causal relationships. And I can see that my My spell checker defaulted from primary to primal, but you can go with primal too if you want. But our primary causal relationships between the component parts of our program. And so at the heart of it is, again, it's not someone else's theory, it's your theory about the idea behind why you think the project will cause a change. The output of generating either with your team or in your own head, a theory of change or the logic model is a problem tree. And the problem tree delineates cause and effects. And so a typical problem tree looks like this. And so this is, again, using the tobacco cessation example. You start at the bottom, the foundation, with the causes of the problem, and you end up at the top layer with the effect of your program. And so, oops, this font is too big at the top. I see it's cut off some of the words. I'm sorry about that. But basically, if we read this from the bottom up, we see that insufficient understanding, the logic here is that insufficient understanding of programs to support quitting and insufficient understanding of why tobacco is addictive is leading to Montanans using tobacco at higher rates than in most other US states. And the effect of the project is that, the effect of those things is that Montanans are using tobacco at a very high rate, tobacco products. Now, the problem tree is a series of statements that identify a problem, and they indicate the logic that the way you're thinking about that problem as the foundation for how you're going to develop a set of interventions aiming at addressing that problem. Now, one way of showing a logic model looks like this, what we have on the screen here, which is a series of statements, in this case relating to behavioral health, that show the flow of thinking. And the way that you read this is starting at the top left. This was a logic model that a team and I developed for persuading a particular funder to use their funds to support a project that would do statewide mental and behavioral health baseline, also clinical training in integrated behavioral health in rural and tribal locations, a social determinants of health education program that would occur in schools, and activities that would influence the policy landscape in rural and tribal communities. So that's the base. That would lead to, next step over top in the middle, statewide centralized public health networks formed to facilitate collaborations, state-of-the-art knowledge, and so forth. And that individuals would be obtaining mental and behavioral health support, including compassionate wraparound care, so forth. Meanwhile, bubble on the right, there would be training ongoing about the social determinants of behavioral and mental health outcomes. That training would occur in schools and communities. And there would be discussions going on, bottom left bubble, about health policy decision-making in rural and tribal locations. This would enable, thought bubble, community-wide changes in attitudes and behaviors toward mental health and increased awareness of the integrated behavioral health approach. And then the next part is showing how that would lead to a decrease in social stigma and increased awareness of the importance of IBH in addressing mental health. And then ultimately, that would result in improving mental and behavioral health and also decreasing healthcare costs overall, like as a long-term objective. And so you can see here the way that the logic flows from the base, the foundation, up through specific interventions that are mentioned, and then the thinking behind what that would enable on the part of program participants or a variety of different stakeholders are looped in here, as you can see. So this kind of logic model that you can see here on the screen is like obviously toggling back and forth between different kinds of stakeholders, from individuals who are struggling with mental health challenges and the utility of helping them address those challenges with IBH, and then other kinds of stakeholders who, other than those folks, who could reliably be expected to contribute toward moving the needle on making services available to them. So this is one of my favorite ways of showing a logic model. I think it's attention grabbing, and it shows the flow of the idea behind the program and its component parts really nicely. Another way, of course, and this is building upon what we talked about yesterday, is the matrix. And so this is, as you remember, the 4x4 log frame matrix, which is, as I described it yesterday, one of the centerpieces of the log frame exercise and approach. And basically, what the matrix does is it crystallizes the ideas in your logic model, or your theory of change, into the relevant parts. And those relevant parts include, as I described yesterday, the things on the left-hand column. At the bottom, we have the inputs. Next row up, we have the outputs. These lead to changes associated with the project's purpose and the ultimate goal. So again, here using tobacco cessation as an example, and focusing specifically on the use of nicotine replacement therapy as one potential component of a program that is aimed at reducing tobacco product use. So we have here, again, the series of if-then statements. So this goes, remember, from left to right and back to left again. So assuming that the input is NRT products, associated labor, maybe some travel associated with distribution. So we have that input. The objectively verifiable indicators include the principal aims of distributing 500 NRT products in 5 sites. How are we going to verify that happened? Next column over, means of verification, data collected at the Public Health Office. And the critical assumption, remember that, part of the log frame approach is thinking about your assumptions and making sure there are no killer assumptions that are going to tank your project. So the critical assumption here is that you have sufficient supply chain. You might want to list out, as you're working through this exercise, other potential assumptions that are relevant. I just put one here so that we can keep it simple. But obviously, one assumption here is that there's a sufficient supply chain of NRT products into our state, and that we can get those out to public health offices. That's going to lead to an output, which is NRT products that are distributed. And then you can go back and forth across this matrix and see the connection of each of these inputs with their assumption, the outputs associated, assumptions associated with those outputs, and how that relates to the project purpose, and then ultimately to the project goal. I love building these matrices. I think this is, in addition to the previous slide where I showed the kind of logic flow, the thought bubbles and so forth, I think this is the kind of thing that, as a reader of grant proposals or a reader of evaluation reports, I really like to see, because it signals to me, as with the use of appropriate terminology or nomenclature, the fact that the author or the person who's planning and probably going to be executing this program understands the importance of having thought through these things from the outset, gone through this mental exercise, discussed it with their team, and has clearly thought through what some of the weaknesses and threats are, and how to build on existing strengths and opportunities. Okay, so in order to get to a complete, I suppose you could say, depiction of what's going to happen in this matrix, we've got to have some clarity around what our project's objectives are. And so what log frame and this entire approach forces us to do is be very, very clear about the delineation of objectives. And so before I get to objectives, I wanted to pop into the poll and to see who among you has already used the log frame approach, or excuse me, how many of you has already used the logic model approach and has already constructed a theory of change. So Desiree, if you could pop that poll in now, I'd appreciate that. There's that poll for folks to respond to in terms of how much familiarity you have with this. this whole approach. Okay, great. Thanks, you guys. That's very helpful. So one of 5 of you today has used this already. So for others, this might be a little bit unfamiliar. That's good to know, because as we go through the remaining steps, I think the component parts will become clearer and will really help folks who are, as you described yesterday in our introductions, who are right on the cusp of developing a program plan or a needs assessment. Remembering, of course, that the log frame approach and the definition of a logic model or a theory of change can be useful in pretty much any of our program exercises. And that's relevant to whether or not you're putting together a strategic plan or a community health assessment, needs assessment, a program plan, or an evaluation. Okay, so for objectives. Now, one of the things that we have to do after we put that problem tree together is figure out how do we turn that into an objectives tree, and one should flow logically into the next one. So basically what we're doing here is restating the problems that we identified in the problem tree approach as objectives. So whereas the problems were stated as challenges and sometimes using negative statements, the problem statements, or excuse me, the objective tree is supposed to be constructed using a series of positive statements, can-do statements, action-oriented statements. Like transforming, no one knows what public health is in my community, to we will educate our partners about public health by doing X, Y, Z. So that's just one example of how you can transform a statement about a challenge into a statement with positives. So the top of the tree is the end that is desired. And so the bottom of the tree and the top of the tree in the objectives tree is very similar to the problem tree, just flipped in terms of the language used. The lower levels are considered to be the means to achieving the end. So like everything else that I've been teaching you about yesterday and so far today, this is very much an approach where your fundamental building blocks are the starting place and the ultimate end is at the top of the pyramid. So another sort of acronym, side SWOT, that we like to see in program plans and also reporting on them are SMART objectives. So SMART is the acronym that means that things are specific, measurable, achievable, relevant, and time-bound. By specific, we mean they are objectives that state what you'll do. They use action words. They're measurable in that they provide a way, by virtue of how we have conceived of them from the get-go, they provide a way to evaluate. They are measurable in the sense that they use metrics or data as targets. They're achievable. That means they're within our scope in terms of time, resources, and person power. And they are possible to accomplish. I know for teams of one that we need to keep it modest in terms of what our objectives are, but even keeping things modest can still fit in with things that are achievable. Relevant, making sense within your job function and improving, the business of what you're doing in some way. And time bound, they state when you'll get something done, and they're specific on that date and time frame. So delineating the unit of time in which you're going to achieve something is critical. Here's an objectives tree for us to look at. So where we have flipped the problem tree over into a series of statements or desired goals that are positively stated. So we're going to have NRT education, NRT distribution, and NRT supports, like for instance, cognitive behavioral therapy is oftentimes paired up in tobacco cessation programs with the distribution of NRT products. That's going to lead to knowledge and acceptance increasing of these things and more people using NRT, with the end result being that the use of tobacco products in the community decreases. Now you notice that I just said the use of tobacco products in the community decreases. I also used decreases, and that brings us back to points I made yesterday. And just to refresh your memory, that when we say things like that in an objectives tree, that's only the starting point. because part and parcel of what we have to do as part of our program planning and evaluation planning is delineate what we mean by community, and also what we mean by decrease. And so you can see here that there's a little bit of, generality or high level use of words in the objective tree, but know that always behind that we have the specificity needed. And we'll come to that in a little bit when we talk about indicators. What I wanted to talk about next is evaluation history and context. I wanted to start by explaining that for a lot of people, I kind of alluded to this yesterday, there is a mishmash of program planning and evaluation in their minds. And I think that's a result of the fact that we often teach program planning and evaluation together, and because of the recognition that program planning is much more valuable when evaluation is a part of it from the very beginning. So program planning sometimes, I think in years past, occurred with very little attention to how measurement of outcomes was going to occur. And so the emphasis on program planning was just completely focused on what would the program components be, how would they be executed, and how many people would be affected and things like that, with very little attention paid to, in the program planning documents, to how we would understand the impact of the change, or the size of the change, or the impact of the change on people's lives. And so over time, that has shifted very, very considerably. So in the 1930s, is around the time frame where we started to see the use of the terminology associated with program planning emerging in the literature. And it refers still to social science research methods that we use to investigate effectiveness of things like development aid or some other kind of social program. Initially, program evaluation was used in a corporate or business climate. And so you can see here just an example of a large manufacturing plant in the 1930s. And this is the exact context in which this kind of thinking emerged. Over time, especially in the period after the Second World War, when the United States government was increasingly involved in things like, for instance, the Marshall Plan, where we contributed very substantially materially to rebuilding Europe after the Second World War's devastation. And then once those projects were completed, attention, energy, and monies were turned to rebuilding other places around the world that were affected by the Second World War, or rebuilding or building economies in low resource settings or impoverished nations, and particularly in Africa, but also in other parts of the world. Of course, African countries were in different ways affected very materially by both the First and Second World Wars in terms of moving borders around and very substantial impacts on economies and so forth. So lots and lots of tax dollars were used to engage in these efforts. Because on the corporate side and the business side, there was increasing attention to evaluation of how well different procedures were working or different practices were working. The development industry, or the aid industry as we now know it, wasn't called that back in the 40s and 50s, but as it has grown, has pulled more of this thinking out of the corporate world and has rebuilt it into the in public programming world, broadly understood. And then that worked its way back into public health here in America. So program planning and evaluation have been, I would say, since about 1970, more and more inextricably linked. And that's why today we think of them together in the same courses and in the same communities and so forth. So the call for program evaluation in our country has kind of waxed and waned over decades, depending in part on politics. So in some In some decades, I think there's been, relatively light emphasis on this, and in other decades, and increasingly through time and intensely now in 2023, there is a laser sharp focus on evaluation. People want to know that program planners are considering evaluation from the start and that monies are being well spent. And so as a result of that, program evaluation in and of itself has grown to be its own sort of industry. Usually, when we think about evaluation, we're thinking about it across 5 domains. Need, what is the need for a project? Design, how well is a project designed? Execution, some kind of evaluation of the execution of project elements and service delivery. What impact are those things having? And how efficiently did a program or is a program working? Like I mentioned before, there are different points in time when evaluation is normally going to occur. At the beginning of a project or at the midpoint in the project, those kinds of evaluations are referred to as formative evaluations. At the end of a project, looking back retrospectively and thinking about the overall impact of a program, we call that a summative evaluation. So it's in summary of everything that happened. Oftentimes, evaluations are principally focused on number 4 on this list, impact. But in fact, a full and complete evaluation would have all of these 5 components: need for the program, the design of the program and its components, execution, how did it unfold, impact, of course, health behaviors or health outcomes, for instance, and then efficiency. So how well were resources spent? And so different evaluations or different evaluators or different funders have different emphases on each of those 5 domains. Like I was saying, many evaluations focus on number 4, impact, but some evaluations will focus on other things. Okay, so practically speaking, there can be pretty substantial challenges to doing evaluation, and I wanted to talk a little bit about those next. So sometimes circumstances change and there are programmatic changes associated with them. So for instance, if you're designing a program plan and evaluation tool or set of tools for a 5-year funding period, you might find that within those 5 years, something pops up, like there could be a downturn in the economy, there could be a global pandemic, there could be this, that, or the other thing. And those things drive programmatic changes as a result. And so sometimes people criticize the logical framework approach as being too static and too unchanging. And I reject those criticisms myself because I think that it's an excellent tool, especially when we think of it as a live tool. In other words, you may set your program plan and the evaluation component of it at the beginning of your 5-year period, but you always have to be tweaking it. It's not static or fixed of a plan. Any plan and any evaluation component of a plan should be understood to be changeable and malleable depending upon whether or not programs have to change as a result of circumstances changing. There can be additional expenses incurred, however, if something like that has to happen, and that can be challenging, of course. But generally speaking, I think all program and evaluation plans should not be thought of as static, but should be thought of as live. Second thing I wanted to cover in this section is the importance of asking the right question. So we need to, in order to ask the right questions, we need to be clear on the difference between an output and an outcome and how to frame questions to get at these 2 very different things within the time boundaries that you have, or ethical constraints or budgetary constraints. And so let me give you an example of what we're talking about here. I mentioned yesterday that I've worked quite a bit on program planning and evaluation in East Africa, where, of course, there is a big public health challenge known as malaria. And one of the very common types of programs that we see used in that context to fight malaria is the distribution of bed nets. And so one question that might be asked of a bed net program in terms of getting back to that dot point above, which is the importance of asking the right question, is, so this might be, for instance, a metric or an indicator that is chosen in asking the question, how many bed nets were distributed? And a corollary question might be, has there been a reduction in malaria? So if you think about that objectives tree schematic that I showed you a slide or two ago, this would be like the middle tier, number of bed nets distributed, top tier, reduction in the prevalence of malaria. The problem with that is that people use bed nets for a whole variety of different purposes in that setting. And you can see in the pictures at the top that this, on the left-hand side, that this group of individuals are using their bed nets to fish. And on the right-hand side, another common use of bed nets is for your bridal veil. And however, not to use the bed net to hang over your bed to keep the malarial mosquitoes out at night, which is when the Anopheles mosquito comes out at dusk and hangs around all night. And so being under your bed net at night is known to be pretty useful. But if the only question you were asking was how many bed nets were distributed, and you did not see a reduction in malaria, but you left out questions and whole and complete thinking about a project like this, about how those bed nets were used after they were distributed, then you would be simply asking the wrong question. It is an important question, but it can't be the only question that you ask about a project like this. It would therefore be erroneous to conclude that the distribution of bed nets was causally linked to lack of reduction in malaria in a particular population, because ostensibly the distribution of bed nets with the proper education about how to use them appropriately and the life cycle of the Anopheles mosquito and how it comes out at night and how important it is to be under your net during the nighttime hours, that combination of things might lead to a reduction in malaria. But the way that this particular set of questions were asked and the project was designed didn't get you where you wanted to go. And so this is just one example of how it seems on the face of it to be a very, very sensible question to ask: how are bed nets distributed, or how many bed nets were distributed? But it only gets to part way to where you need to go, and isn't going to help you understand any changes or lack of changes in malaria incidence reduction. So another thing I wanted to talk about in terms of evaluation is that sometimes people don't want an evaluation to proceed. So that is going to get us to thinking about the relative costs and benefits of doing an evaluation internally versus doing an evaluation externally. There are lots and lots of companies in the world that do evaluation all day long, every day long. That's what they do, and you can hire them to come in and do an evaluation of your project if you lack the person power in your office or on your team to get this work done. But when we hire external evaluators, there are some things that can happen. Sometimes people actively are trying to avoid scrutiny. They, for instance, might deny the need for an evaluation. People on your teams might act that way, or they might feel like or claim that the evaluation would just take too much time away from other work, important work that they're doing. And sometimes we can see where an external evaluator comes in and fails to establish the right relationships out of the gate. People are using delaying tactics or other things like that to reduce the scrutiny and the impact that an external evaluator might have. And that leads me to my cartoon on the right, where the man is saying, "No, Thursday's out. How about never? It's never good for me." That kind of thing with the delaying tactics can sometimes occur. And once evaluations have been initiated, Sometimes we see where people might want to omit or distort information. They might give too much information, so the evaluator is swamped with data. Or sometimes might want to, say, for instance, introduce new data toward the end of an evaluation, which can skew results or confuse things. And so some of these factors are important to kind of have in mind thinking about how to get an evaluation done or how to build it into your program planning. So where does monitoring and evaluation fit? Like oftentimes we refer to evaluation as M&E, or monitoring and evaluation together. And this schematic from something we put together in Uganda, so you can see the UK spelling of program. For the program management cycle, you can see monitoring and evaluation sits at the center of it. And those two-way arrows in every case are there because of the importance of monitoring and evaluation from the get-go in project planning, in terms of at the top, problem identification and cause analysis, over to the right-hand side, goal and objective setting, at the bottom, designing and implementing the plan, and then the implementation, service and delivery. All of these things are informing evaluation and monitoring, and informed by monitoring and evaluation, ideally. This might cause you to ask, what is the difference between monitoring and evaluation? And I think if you're wondering that, it's a great question to ask. You know, oftentimes in public health in America, we just use the word evaluation, but globally speaking, it's typically used in pairs with monitoring. So monitoring, evaluation, M&E are used almost pretty consistently together, but they mean different things. They refer to different parts of the pieces of the pie. So on the left, you can see here that monitoring refers to the plan and systematic process of observation. It closely follows the activities and compares what's happening and what's expected to happen. So it's really kind of, monitoring is really kind of more focused on the inputs and the outputs, that lower end, those lower two rows of the log frame matrix. Whereas evaluation is a process that assesses achievements against the preset criteria. And that, of course, has a variety of purposes and can follow distinct methodologies, like I mentioned before. But evaluation is aimed at the top two rows on the log frame matrix. So where we're looking at goals and outcomes of the project as a whole. So on the monitoring side, we're looking at that. We're looking at kind of the widget level, the sort of bean counting level of making sure that what was proposed in terms of the specific outputs is actually happening. And so it is a really important first step to getting the work done, but it's only the first step. So it's the periodic collection and review of information. Of course, this has to be open to modification if circumstances change, as I alluded to before. It allows us to identify, the monitoring phase allows us to identify shortcomings before it's too late. And it gives us the building blocks for identifying why progress falls short in some instances. Then evaluation on the right-hand side, this is the systematic process to determine the extent to which the broader service needs and results are being achieved. So here we're looking at the relevance, efficiency, and effectiveness of the program itself. Okay, so I've been referring repeatedly to the different rows here of the log frame matrix. So you have inputs, outputs, outcomes, and impacts. And this next set of notes is to just kind of drive home the difference between each of these things and the significance of being very clear in your thinking about the difference between each of them. In program planning and evaluation, the two things that we tend to see being mixed up the most frequently are outputs and outcomes. Oftentimes people talk about outcomes, but they're actually talking about outputs. And so let's walk through these one by one and see what the difference is. So inputs, as I've described before, are the resources that are provided for the activity. That could be like cash or other resources, capital resources like supplies, be personnel, equipment, training, think of this as like your person power, your capital investment. Outputs are the specific products or services that result from those inputs. And activities that are delivering, for instance, as a result of receiving those inputs. Outcomes are the next row up. So the third one from the bottom in the log frame matrix. And that refers to how people are responding to the outputs and how they're changing their behavior as a result. So these are more short-term effects that relate to the objectives of the project. And the impacts are the longer term, the higher level outcomes. So, or the higher level results of a project. So this is like maybe broader economic, social, organizational health, and so forth, levels of change. So moving the needle on the prevalence of malaria, for instance, or moving the needle on the incidence of lung disease, if we're thinking about tobacco, or reduction of the use of smoking products, for instance. The moving the needle on the prevalence of certain kinds of tobacco-related or tobacco product-related cancers, for instance. So the highest level is the impacts. A level below that are the outcomes would be like things pertaining to behavioral health changes that are associated, or actual behavior changes that are the result of adding nicotine replacement therapy. So actual reduction in use of tobacco products. So I'm going backwards on the chart here. Whereas outputs are the things such as, keeping on this tobacco cessation example, the increase in the distribution of nicotine replacement products or therapy, and then the inputs are the actual availability of those products, the person power associated with getting them distributed, and so forth. So you can toggle back and forth up and down that chain and make very clear in your mind and in your writing, in your program planning and the evaluation thereof, of the difference between each of these four levels and how one relates to the other. And that's what LogFrame helps us do. So I mentioned before that internal and external evaluations have their challenges. And I wanted to spend a little more time thinking about that because I know some of you are short-staffed and might be in a position where you have more availability of project funding and less availability of person power within your unit. And so on the left here are advantages associated with having someone associated with your program or yourself conducting an evaluation on a program you're running yourself. So one thing is that you know the organization, the program, the operations inside and out. You understand and can interpret behavior and attitudes of your organization's members. You are going to be privy to important internal and informal information. You're known to your staff and to your community, so that means you're less of a threat. You should possibly be more easily accepting and and able to promote the use of evaluation results. Internal evaluations are usually cheaper. You don't have to do any recruitment of an external firm. And this can contribute to strengthening internal evaluation capacity. You train yourself up as a program evaluator, if you're doing it yourself, obviously. But the disadvantages of having an internal person and not hiring an external person to do your program evaluation is that you can lack objectivity. You may unthinkingly or unwittingly, not in a nefarious way, just because you agree with the logic model, you may just simply accept the position agenda assumptions of the organization of the program itself. Oftentimes, program executors are too busy to fully participate in a full program evaluation. And internal people are part of the authority structure already. They may be constrained in their objectivity. And also, oftentimes what we see in local health departments or public health offices is that people are coming in from other ranks, like from the clinical side. We have lots and lots of nurses, for instance, and so forth, and people who lack formal training and evaluation, and that can be an impediment. And so, yeah, just lacking that that training background and so forth can be a big challenge. So I think thinking about if you want to run evaluations internally or externally is very important, and again, has to happen at the very beginning of the program planning process. All right, I just heard the bell tower go, so we're at halfway through our time together this morning. We're at the top of the hour. So I had planned in a 10-minute break here. So let's break for 10 minutes. People can use the bathroom or what have you, and we'll reconvene at, let's see, 12 past the hour. Okay, so now, before you start with the evaluation part of the work that you're doing in your office, you want to spend quite a bit of time planning the evaluation itself. So this is planning the evaluation component to your program plan, which should have the evaluation piece included. So this is the part about planning the evaluation itself. So on the right-hand side of our slide here, we can see a schematic that kind of, or a listing of how it works, including objectives, strategies, and management process associated with some of the things that more generally or more specifically you might like to include in your evaluation. So you might want to start out by thinking about describing the policy environment, economic and financial feasibility, institutional capacity, the sociocultural aspects, participation and ownership, environment, and technology. So these are sort of high-level frames that you can use to orient the way that your evaluation is going to be written. So in thinking about those factors on the right-hand side there in that green box, you're going to help yourself determine what is the purpose of the evaluation. Because like I said before, evaluations can be pitched at any number of levels. They might be very focused on inputs, they could be very focused on outputs, they could be very focused on outcomes, or they could be very focused on impacts. Many evaluation plans include all 4 of those levels of the log frame matrix. And some just focus on one level, and it depends on when in the program cycle you're doing your evaluation and who you're doing your evaluation for. So determining the purpose of the evaluation is critical. So related and building upon what I just mentioned and picking up on references to this earlier today, the type of evaluation has to be considered. So is this a baseline? Is this just a starting time 0 point? Building on a needs assessment or a community health assessment, for instance? Are you doing a midpoint formative evaluation that's occurring at some point later than time 0? Or are you doing a summative evaluation at the very end? Who's going to conduct the evaluation? So with the evaluation team, picking up on threads from before about considerations about internal versus external evaluators. You're going to plan your evaluation based on what information exists that can be, sort of the starting point. So for instance, program documents are going to be critical, including program documents that cover the monitoring pieces. So what is the progress being made toward, or what is the evidence for progress being made toward hitting those output factors, or like the widgets and the bean counting sort of thing. That monitoring information is important to have access to. What are the available information sources? And as an evaluator yourself, what are your strengths and limitations? If you're flying solo and your program planning program executing and program evaluating yourself, it's totally fine to set a more modest goal for yourself in terms of doing an evaluation plan. I would say a more modest but well done evaluation plan is better and more useful to your office and your team and the community that you serve than an over ambitious but poorly executed evaluation. So I would be very honest with myself about my own strengths and limitations and having to do with the resources I have available and time as well. Selecting appropriate evaluation methods comes next, and those evaluation methods pertain to all of the cogs in the wheel, including inputs, outputs, outcomes, and impact. This depends on what your evaluation goals and objectives are. You want to formulate your evaluation questions and sub-questions, obviously, at the start. And you want to think about the appropriate evaluation design. For instance, is your evaluation design going to be like a baseline and follow-up comparison between two time periods, or are you going to compare one community where an intervention was put in place and another community where an intervention wasn't put into place, or what have you? So thinking about the evaluation design itself is an important first step. And identifying your measurement standards and indicators comes next. And so in the following slides, I'll talk some about indicators. You want to do some time on the evaluation schedule and also the budget that you have available to you. So in determining what your evaluation questions are going to be, you want to think back to the part of the process that involved thinking about your stakeholders and your stakeholder analysis. So what do you think stakeholders want to know? So evaluations are written for somebody. There's always an audience. And the reason that we see different kinds of evaluations being conducted is that different stakeholders exist. So an evaluation for instance, a program client might be pitched and aimed a little bit differently than about an evaluation that's designed for a program manager, a funding body, or a program staff person. And so there are, under each of those categories here on the slide, you can see some example questions that might be relevant to these different groups of stakeholders. So for program clients, they might want to know, did the program provide high quality service? And so your evaluation is designed to answer that question. The metrics are appropriate to that question, the indicators and so forth. Are some clients provided with better services than other clients? If so, why? These are kinds of things that would be interesting to clients. Maybe your evaluation is for program staff. So does the program provide the clients with high quality service, and should staff make any changes with how they perform their work as individuals or a team to improve that, and so forth. So you can work your way through these questions at your leisure. If you come back to these slides at a later time, I've just let another listener into our training here. So toggling back and forth between the screens here. Program managers, by contrast, might also be interested in the quality of the service, but they want also to know what things or roles managers can play to change their own activities to improve program processes and outcomes. Funding bodies are going to be more interested in understanding how well the resources they invested in the program were used. Was it an efficient use of resources? And how do we know that? This helps them answer questions about whether or not they want to change the level of funding that they're making in a program, and helps you as the evaluator or program planner or executor understand that as well. Okay, so I was going to pause here and see if y'all have any questions, and make sure I took a moment to look in the chat, because sometimes when I get to talking, I ignore the chat. So Desiree, I'm not seeing that anything has appeared in the chat. Is that right?
Oh, I've been monitoring. There hasn't been anything. chat as
okay, super. I wanted to make sure I took time to do that. All right, so let's move on then, if nobody wants to jump in with a question at this point, and talk next about those indicators that I've been referring to. Okay, so these are, this is the stage in the planning of the evaluation where you're going to think back to some of the precision requirements that I started us off with thinking about yesterday when we first got together and started thinking about how you frame a question or how you frame a problem or how you frame a solution, linking specifically to a time-bounded unit of, or a bounded unit of time where you're moving a set of behaviors from X to Y, where X and Y are very precisely stated, and they're stated in a manner which is smart, which is measurable, attainable, and so forth. Okay, so an indicator is choosing our indicators is what gets us to the ability to do that. So that's a standardized objective measure that allows us to measure specific things like, for instance, you might want to be making a comparison among health facilities. So using our tobacco cessation and the particular component of NRT, nicotine replacement therapy, you might want to compare facilities in terms of the increase of NRT use in patients between facilities 1, 2, and 3 over the last year. You might use indicators to make other kinds of comparisons, like between or among counties, tobacco use per capita in County 1 versus County 2. You might use indicators to make a comparison between something else, like different time periods. So NRT reliance or use in 2022 versus 2023. Or you might choose an indicator as a measure of progress toward achieving specific program goals, like NRT use at the beginning versus the end of a project. So characteristics of indicators are the same worldwide. The first is that they have to be clear. That means they're easily understandable by everybody. So our indicators shouldn't be overly complicated or obtuse. They have to be things that are understandable, not just to us as public health practitioners, but also to our clients and the people whose behavior we're hoping to influence with the projects that we engage in. They have to be useful. They should represent all of the important dimensions of performance of the project. So for instance, like I was describing yesterday, you might, in your logic model or your theory of change, envision that a particular disease process or health behavior is different in people of in different categories of people. Like it might be different in males versus females, youths versus elders, people of one ethnic or socioeconomic background versus another, and so forth. So if you don't pick an indicator or a metric that represents all of those important dimensions of performance of a program, then you'll miss out on those important characteristics. And so it's just bringing us back to the significance of the brainstorming thought exercise phase of program planning paired with program evaluation. The intentionality and mindfulness of the way that we do these things is absolutely critical. Then that gets to the utility or usefulness piece of indicators that have all these characteristics. Third one, measurability. So we like to see metrics that are quantitative. So they're rates or proportions, percentages, or other quantifiable characteristics of behavior and so forth. And they need to be reliable. So metrics or indicators need to be able to be consistently collected by different data collectors. So, with a nod toward the fact that personnel change is frequent and relatively rapid in our state, in our public health workforce, it's important that we bear this in mind at all times. Last, validity. So our indicators have to be valid. They have to measure what they actually need to measure. And that brings us back to our BedNet example. So if you're if you're trying to choose an appropriate indicator of the efficacy of a malaria reduction program, you only go with number of bed nets distributed in that example. You can see that that wouldn't be a valid selection of indicators. It's a good starting point, but it's not going to capture the whole story. So the next step is step 9 of 10. And that's the one where we're actually choosing those indicators. So our indicators should always demonstrate the extent that results have been achieved. They should specify how that achievement was verified and understood. And they are really the foundation of a project's monitoring and evaluation framework. So choosing indicators wisely is very important. And I love to see the choice of indicators being done in teamwork or workshopped so that various eyes-on can influence the quality of the selection process. So the indicators that I've shown here are an example of, pulling from that tobacco cessation type of project, specifically focusing on the nicotine replacement therapy component of such a project. Obviously, you might have a different 4x4 matrix for each project component. Like this is, in this training, I focused on NRT as one component of potentially of the tobacco cessation program, but you might have other components that you're interested in as well. That could be, they are conventional components of a tobacco cessation program, like I mentioned before, cognitive behavioral therapy or prescription drug use and so forth, other than our NRT. And so there could ostensibly be multiple matrices that you construct depending on how many project components you have. Each project component has its own indicators and metrics. In this instance, the objectively verifiable indicators are visible there in the second column from the right, which I just highlighted with red here in the slide. And so you can see that at every level of at every row, moving from the bottom up, you would have a different set of objectively verifiable indicators that go from very specific at the bottom, sort of the widget level at the bottom, and going up in conceptually in sort of level. So we start with, at the bottom, our indicators are the number of NRT products distributed at the number of sites. Next level up at the level of outputs, this is the number of NRT products actually in the hands of clients and attestations of use by those clients of the NRT. The next step up is the per capita usage of NRT in the sample area. And then at the final column at the top, or row at the top, the number of NRT use, so the percent of NRT use per capita increase from X to Y. And so you can see each level has something specific, a set of indicators or an indicator specific to that level. And you can toggle between them in terms of the sort of specificity and impact on population health. Indicators, like our objectives, should be SMART, reminding us again that SMART is the acronym that stands for SMART, is specific, measurable, accurate, and timely. And I just realized I left out R, which is reliable, getting back to the inter-rater reliability of any particular metric, that anybody in your office should be able to use it. And its usage doesn't vary from one person to the next. Last but not least, step 10. This is where we go back to checking our assumptions. So in my presentation yesterday, I talked through the difference between types of assumptions and remembering that the killer assumption is always lurking out there. Potentially, we need to do some foregrounding of what those killer assumptions can be. But in checking our assumptions, we're walking ourselves through this list. So for starters, we're describing the necessary internal and external conditions that we have to have in place in order to ensure activities are going to produce results. Assumptions are in and of themselves, they are risks. They can jeopardize the success of our projects. So we need to think about what they are and how to mitigate them. Generally speaking, we word our assumptions using positive statements. They describe circumstances that are required to achieve certain objectives, and they should be relevant and probable. And if an assumption is not important, or it's also almost certain, I wouldn't bother mentioning it in my project plan or in my evaluation plan. And also, like I was saying, we need to think about what our killer assumptions are that could completely tank our projects. And that goes back to the importance of having multiple eyes on the project plan and the evaluation plan from the get-go. Okay, what are some examples of assumptions? So some examples would be things like that there is political stability and support for the strategy and the availability of, say, for instance, government staff. Like in our circumstances here in the state of Montana, we want to assume, for instance, that DPHHS is supportive of the work that we do and that our goals and their goals align. There might be economic assumptions that we make that there will be a sustainable economy to the point that our project goals can be attained. I forget who it was yesterday in their introduction talked about that one of the effects of the pandemic in their community was pretty substantial job loss, and that was having a significant role in the work that they were doing relating to mental and behavioral health as well as SUD. And so sometimes our assumptions are not met. I would imagine that in that person's circumstances, they in 2018 might have been engaged in program planning or evaluation plan planning that did not account for something like what we experience in our state in terms of the economic impacts of the pandemic. And so the pandemic was certainly a lesson for all of us in terms of the assumptions that we made relating to the economy and its impact on our work. Adequate funds and materials would be a reasonable assumption. Adequate skilled people with training needs being met. That approvals and contracts can be obtained and put into place, including those legal and administrative considerations. And last, that there will be the participation of our stakeholders. So these are examples of assumptions that I think it would be important to go over either internally with yourself or with your team members in the program planning and evaluation. All of these assumptions, if not met, can feed into the quality control and quality assurance needs that we all have as public health practitioners and program managers. So they are, it is important to spend some time thinking about these things. Okay, now I'm going to switch a little bit over to program implementation, and that's going to lead me to some final remarks having to do with just, drawing conclusions and dissemination of results. Okay, so once assessment and planning have been completed, the next step is implementing those strategies and interventions that will comprise the, say, for instance, workplace health program. And so program implementation would involve all of the steps needed to put health promotion strategies and interventions into place that would make them bestly available to employees and staff members. Other program implementation considerations might be things like developing communication strategies for our leadership and our employees or our team members, thinking more and back to the governance structure, and obtaining resources that we need to move a program forward, staff, equipment, vendor contracts, and the like. And then establishing data and informatics systems for program quality improvement and evaluation. All of these things have to be into place with the evaluation plan as well before we can begin program implementation. Building relationships with community partners we know is absolutely essential, and that comes back to earlier sections of our training focusing on stakeholders and stakeholder analysis. we have to spend some time thinking about recruitment and supervision of our program staff, staff retention leading into considerations of training for staff, and any liability considerations that we might have to have thought through before we begin our program implementation. Some challenges might include the resources and sustainability pieces, geographic limitations, which is particularly acute in some of our more rural and remote communities, and some of the work that you all are doing to reach out into communities that are distant from the main campus. Recruiting staff, we know, in public health workforce is an increasingly big challenge, and getting to hard to reach populations as well, kind of related to that if we're running low on staff or are understaffed. Cultural and social issues as well can come into play, and this is particularly serious of a consideration for those of us who are working in more multicultural settings. And that really varies so much across our state. In some instances, our counties are fairly homogeneous, and in other instances, they're really not. And so thinking through what might be the deeply rooted traditions and cultures, like for instance, around food. We have a lot of obesity-related programming, for instance, that our public health ranks are engaged in. And the way that those play out in different communities can be profoundly different from one to the next. In some communities, we see a profound lack of trust for medical professionals and also outsiders. And we have different social beliefs around certain behaviors relating to health and health seeking that can be very disparate from one community to the next. And some of our participants in this training alone are working with Hutterite communities, for instance, where people in those communities have a set of beliefs around health and health-seeking behavior, which are constrained by their own religious ideology and community structure that pose a very particular set of challenges that are distinct to challenges working in even immediately adjacent communities where non-Hutterite people are living. So, you know, I think to outsiders who don't live in Montana, maybe the amount of cultural variability that we have here is a little bit understated, but these things can play a big role in our work depending upon what county or counties we serve. Language we see as increasingly significant, but beyond language, the cultural constructs behind language, I think, can be extremely important in terms of program implementation and how our planning and evaluation unfolds. And, you know, the constructs behind different types of languages, for instance, are unknown or unsurfaced to many of us. But for instance, in the grammar of languages that are spoken in our Native communities, the way that people use language forefronts the action of different players or actors differently from the way that the grammar works in English. And so understanding language can be a more nuanced set of considerations than just like, does this person speak, for instance, does this person speak Spanish or English as their first language? So within our state, we public health practitioners are oftentimes interacting with Native people who not only speak as their first language, not English, but also a language where the grammar of the language itself emphasizes different constructs of reality than English does. And so understanding those things or being sensitive to those kinds of things can be really surprisingly important in the work that we do. Last, in terms of challenges in program implementation and planning and evaluation, we want to think about ways to keep our community motivated. Some of the participants in our training today are trained in community motivation, and so this will be familiar territory to you, but keeping the community motivated as participants and stakeholders is something that we definitely like to spend some time thinking about. When we draw conclusions about the work that we've done kind of, especially importantly, as we are designing our summative evaluations at the end of our project periods, we want to think carefully about whether or not the conclusions that we are drawing are evidence-based. We want to think about assigning conclusion categories. So you can see on the schematic here that there are categories including those public health considerations that are urgent public health hazards versus non-urgent public health hazards, no apparent public health hazard, and so forth. And so thinking through the urgency and severity of the results or the findings of the work that we do, evaluating the programs that we've planned and executed is something that you want to spend some time thinking about as well. In the final step of drawing our conclusions, after we've determined what those conclusions are, assigned conclusion categories, we want to think about what recommendations we're making for public health actions. And so to get to that recommendations stage, we want to think about how to adequately describe the results of the program that we've been involved in and that we've been evaluating. So here's an example from a summative evaluation. So that's an evaluation that occurs at the end of a program period. So we want to start with thinking about what were the outcomes. We want to present data on the primary outcome measure or measures and compare that back with the baseline if it's available. So this is going to bring us back to the needs assessment that was referred to at the beginning of the program planning. Remember, I advised that in program planning, including the evaluation component of our program planning, that we refer back to either the literature or to records available at the county level or to community health assessments or needs assessments that have been conducted either by ourselves or our predecessors in our offices for our particular population that we're serving. This can be compared to the goals set for ourselves and to the benchmarks that we included in our program planning evaluation plan. We want to provide data in addressing what the outcomes were on any secondary measures that we might have used to support our conclusions about program outcomes. We also want to think beyond outcomes. What else did we find out? We might want to answer questions about, as we went through executing the program and evaluating it, what additional questions came up, either questions that we ourselves generated as evaluators, or maybe that came from the clients or other stakeholders who we were serving or involving. Lessons learned, other interesting findings that came up should be reported as well in our description of our results. And I'd like to encourage people to think about ways to display the information that they collected and the analyses that they conducted visually. So using figures and tables to help people understand the work that you did, I think is in some circumstances extremely useful. This is going to bring you back to thinking about who our audience is when we're writing an evaluation. So for some audiences, receiving and understanding information visually can be extremely effective. For other audience, not so much so. But when we're thinking about displaying information visually, we want to use, typically the sort of normal set of figures or graphs that are available to us, from line graphs to bar charts to multiple bar charts, pie charts, scatter diagrams, and so forth. And all of these kinds of visual depictions of information are easily generated using Excel or other similar data analysis programs. But when we are going about constructing figures that help us display the findings of our analyses or the findings of our evaluations, I think it's really important to consider our audience. So bearing in mind that some people don't receive information visually as well as others, even those who do prefer to receive information in charts and figures or tables or what have you, can find certain ways of displaying information in that fashion to be overwhelming. And we sometimes as authors inadvertently contribute to overwhelming our audience. And so we refer to this as overuse of chart junk or excessive data ink. And so I invite you to compare these examples of chart junk or data ink. And so on the left-hand examples, you have two multiple bar charts, one at the top, which is very busy and distracting to the eye, one at the bottom that has exactly the same information, but really pared down the amount of information that's on the figure itself. So removing all of these hash marks and additional lines, colors, and so forth, and just moving toward a more elegant description or depiction of what we're getting at here, I think can be very welcome to most of our readers. Similarly, on the right-hand side, you have the exact same tables of information presented with, on the top example, lots of lines, on the bottom example, fewer lines. And most people find the bottom table easier to understand and less distracting. And so I would just encourage you, as you're thinking about displaying information visually, to think about not overly complicating your descriptions or your depictions, recognizing that for some of our audiences, receiving information in this fashion can be overwhelming or unfamiliar, but keeping it simple even when you just do decide to go this route. Okay. When we're drawing conclusions, in addition to the considerations mentioned above, we want to address whether or not the project's goals were met first and foremost. Adding on to that, we want to consider what key barriers were targeted, what actions we took were the most effective, and why they were. And if project goals were not met, did you miss some sort of key barriers to improvement in the program planning stage? And how can the people who come after you or people who are replicating or improving upon your project learn from your identification of those lapses, of those missed key barriers? I think it's important to think about whether or not the idea was good. Was your logic model good? Was your theory of change sound from the get-go? And if it was good, but there were barriers to implementation that you didn't anticipate, I think it's very important to talk about those very honestly and candidly so that people can learn from them. So what were those in your case, and how could they be overcome by people who are doing a similar project in a similar setting, or even in a different setting? What other things might they want to consider? So it's appropriate to include all of that kind of information when you're writing your evaluation report. Sometimes we see in evaluation reports that people are honestly attesting that they only got part way to where they intended to go. So for instance, they have a measurable change in knowledge, say for instance, of the efficacy of NRT, but no change in behavior. So no significant difference in the usage of nicotine replacement therapy, although people do understand it better and its efficacy better. So I think as a reader of lots and lots of evaluation reports, I absolutely love it when people are honest and transparent about the fact that they did achieve X, they didn't achieve Y, and how can they miss the mark on part one. Oftentimes what we'll find is that the interventions that we planned, executed, and evaluated produce other results. So there might be some unintended consequences, some of which might be positive and beneficial, some of which may be negative unintended consequences. And it's always important to recognize those as well. In fact, there is a whole sort of side industry in community development, health related or not, about project failures. And the trend is to acknowledging and describing project failures rather than sort of blithely ignoring them and just focusing somewhat carefully on project successes. So as somebody who reads lots of these kinds of reports and generates them myself, I do focus on recognizing what didn't happen, what some of the unintended consequences were, both positive and negative, and I love to see that. All right, so dissemination is the final sort of the final stage that you want to think about at the very end of all of the work that you've done. Who are you sharing this information that you've generated with? And like I said before, I think we have, as public health practitioners, we have an ethical obligation to think clearly about dissemination and to do it. So we want to, first and foremost, we want to think about disseminating the results of our evaluation back to the original stakeholder groups. We want to remind them along the way what the needs, goals, and actions were. Our dissemination should address additional questions or concerns that we might either have received already from different stakeholders or that we might anticipate that they have. So that kind of exercise where in your writing you recognize and acknowledge and include stakeholders might wonder X, Y, Z, and here are the answers to those possible questions. I think, again, that signals thoroughness and an intent on your part as the program planner, executor, in many cases, and evaluator, to be complete, thorough, and honest and transparent. And then last, continuing that through thread of our ethical obligation to share information broadly, I think there are other venues that we always want to consider. Maybe our organizational newsletter, maybe there would be summaries of subsections of our evaluation reports that we want to send out to specific groups, maybe our patients or clients, our providers, or staff members, program managers, our funders, and so forth. Maybe you have a trade association or a conference or publication that you want to aim at. If you feel that you might not be in a strong enough position yourself in terms of the time that you have available or the experience that you have writing, for instance, publications that go out in scholarly publications, again, I would encourage you to never be shy about contacting faculty members and researchers across the Montana University system, because I can promise you that folks here on our campuses are eager to hear from folks who are working in the public health offices and departments around our state, always eager to engage and looking for opportunities to co-author publications with folks such as yourselves. Maybe there might be a scholarly type or a practitioner type research conference presentation that you could aim for. And don't forget, we have the Montana Public Health Association meeting annually in September. And I put their website there on the screen in case you're interested in going and maybe doing a presentation yourself. And last but not least, the popular press, of course, is always available. So reaching out to the local or state or more broadly national popular press is always an outlet that I like to see people using to disseminate the information that you're generating about the good work that you do. Okay, I see we're we're almost up against 11, and we have 5 minutes left, and we have an evaluation typically associated with our trainings through the Public Health Training Center. And Desiree, is that something, should I turn things over to you and Emily now that I've concluded my remarks?
Well, if anybody has any questions, now would be an appropriate time to ask. There wasn't anything in the chat box, but the floor is yours.
Thanks. Yeah, I just popped into the chat myself and see that you've already got the evaluation link there. Thank you, Desiree. All right, everybody. Well, that concludes our time together this week, and I look forward to seeing you on other trainings that we do through the Public Health Training Center. I do SUD specific ones, the social determinants of health training, and I'll be there at the Summer Institute this summer with more program planning and evaluation tips, tricks, and hacks to make that work easier, including some tabletop exercises to actually finish our session with an entire program plan and evaluation component to a program plan done. So if that's of any interest to you, that's also available. So that's in July. And again, thanks so much, everybody. I appreciate your attention and the time that you've shared with us.